Hey guys, in today's video, I'm going to be taking you through my mercury filling removal process with the Center of Holistic Dentistry in Los Angeles, California. In the description below, you can find some chapter markers in case you'd like to skip around the video and get to the parts that you're most interested in. But in summary, it's going to be a 2-day visit. On day 1, we're going to get to meet Dr. Dalwani and do our consultation that you'll be able to see real time, along with receiving some education from her, and you get to see how the exams go before we are able to do the procedure on day 2. Day 2 is of course the day of the procedure, where you'll get to see everything that it takes to prepare for the procedure and the procedure itself. The reason why we film this is because it can look very intimidating, but through my experience and doing this with you guys, I'll be able to share with you what it was really like in my review later in this video. In the final portion of the video, you can actually find Dr. Dalwani herself answering frequently asked questions, just in case you have any curiosities or want to know a little bit more about her as a dentist and her practice. And lastly, before we jump into this experience together, I want to say thank you to Megan, the consultant that helped me find Center of Holistic Dentistry. If you're currently on the hunt for a holistic dentist office, I recommend checking them out. I'm going to leave all of their information for you down in the description below.
Hi Lonnie, everyone's ready for you.
Thank you. I'm excited to be here.
Yes, we're excited for you.
So tell me, how can I help you today?
I recently chipped one of my molar teeth,
Okay,
and it's where I have a cavity.
okay. Are you having any pain or discomfort anywhere?
Thankfully, no.
No, okay, great. Is there any mercury involved?
Yes.
Yes,
There is.
okay, that tooth has a mercury filling as well. So we're gonna take a look at the x-rays, the photos, we'll take a look at everything, and then we'll get a game plan, but obviously we're gonna focus on the tooth that's, a concern for you.
Okay.
Okay, great. Let's take a look at the x-rays and see what's going on. Okay, so it looks like that is your first molar there. You have a mercury. Did part of your tooth chip along with it?
Yes.
Yeah, it is close to the nerve,
Mm-hmm.
but I think we're still safe, so that's good. We'll clean out the tooth really well. We'll ozonate it. We'll help disinfect it. So we'll do everything we can to hopefully keep that nerve healthy and hopefully not needing a root canal.
Okay.
Okay, other teeth look really nice. I'm not seeing any other cavities on the x-rays, so that's really good. How often are you flossing?
Every day.
Plaque tends to build up every 10 to 12 hours.
Okay.
So if you are open to increasing the frequency of your flossing till twice a day,
Yeah.
keeps you away from me. That is a tissue fluorescent light only that shows any changes or abnormalities of the soft tissue, cheek or tongue, okay?
Okay.
You're just gonna feel a little bit of the warmth of the light, but no pain or discomfort.
Okay.
And you may just wanna close your eyes just in case the light gets a little bright, okay? Excellent, everything looks wonderful. May I put a little bit of organic chapstick for you?
Yeah.
This is individual use, and I will give this to you when we're done. So let's take a look. Yes, so I can see the part of the front part of the tooth and even the back part of the tooth has chipped off. There's a mercury in there, so we'll do a procedure in which we safely remove the mercury and then replace this old filling with a conservative ceramic restoration. And I'm going to show you a little model of that. I would like to explain the difference between a crown and an onlay. As you know, we try to practice more conservative biomimetic dentistry, so whenever possible, we prefer to do a porcelain onlay, which is right here. This is a porcelain crown. A porcelain crown is when we have to circumferentially remove 360 degrees of tooth structure. There is a time and a place, but I think many of the times we can avoid doing something like this and we can do something like this. And as you can see, this is the same material, it's porcelain, but it's very conservative, where we can keep a lot of your front tooth structure, we can keep a lot of your back tooth structure, and only have to work in the middle of the tooth, usually where we find the cavities. The gum tissue likes to be around natural tooth, less post-operative sensitivity, a better aesthetic result. This is just a win-win overall. We do a little bit of laser and ozone to help with inflammation.
Okay.
So we don't use any fluoride, we don't use chemical rinses, we don't use localized antibiotics in the pockets, we don't do that. We don't use metals in the practice. We try to keep to ceramic restorations or BPA-free composites. We just try to be very careful about what we put in your mouth. Okay. And if things that you have in there are not very healthy, like mercury, for example, then we will follow a safe protocol to remove the mercury. And we follow the IOAMT protocol. And they're kind of the leading organization on safe mercury removal. So what we'll do, we will drape you from head to toe. We'll give you a nasal cannula so you're breathing in pure oxygen. We'll use a rubber dam, which is basically a piece of fabric. It covers the mouth and the throat, and we make a little hole in that fabric so we can just work on the tooth that we're working on, and then the mercury will go down your mouth or your throat or your cheeks. Okay.
Right.
And then here we'll use ozonated water to rinse and clean throughout the procedure, and then I'll recommend a couple of supplements for after to help naturally chelate the mercury.
Okay, great.
I have you take chlorella,
Okay.
and chlorella helps bind the mercury or metals and help you naturally excrete them. All right, Natalia, so let's refer to the oral surgeon for the wisdom teeth. Number 3, we wrote down, we're going to do a safe removal along with the build-up and a very conservative MOBL only.
Hi guys, today is the big day where I'll be getting the mercury removed and a temporary put in. Natalia is starting off with setting up the ozone water machine. And next up, we are preparing for the procedure with all the proper safety gear. Now we're getting started with the numbing process. I do want to note how incredible she was through this experience. I've never had a dentist so thoughtful and caring during a procedure. The part that blew me away was that she even put a numbing cream on my gums with a Q-tip before using the syringe. It was truly painless and I was actually surprised. Now comes the part that looks super intimidating and scary, but it is the step you definitely want to ensure your safety. This here is called a rubber dam, which protects your throat from inhaling the fumes during the procedure. Hopefully you can tell that only the tooth that she'll be working with is exposed. Something I also loved and definitely recommend is asking for the piece that helps to keep your mouth open comfortably during the procedure. After the rubber dam application, they went on ahead and gave me oxygen so that I would be able to breathe perfectly fine and comfortably during the procedure. And then now you're gonna see they are bringing in this special vacuum that I mentioned to you guys earlier in this video during the intro to make sure that that takes the fumes in once the mercury comes out of the tooth. That completes the prep, and now Dr. Dalwani is getting started on filing and getting ready to get that mercury filling out of there. I promise you guys, I felt not a thing at all. The procedure lasted about 45 minutes and went by fast actually. Another tip for you guys is to not be afraid to signal the assistant if at any point you need your mouth drained. Your comfort is key, and thankfully Natalia was definitely on it.
Lonnie presented to our office with a broken mercury filling. Everything else in her mouth was great, good oral hygiene, great dentition, just one tooth was really problematic. What I recommended was a safe mercury removal first, removing that mercury out of the mouth safely, and it was a very large existing mercury. I tried to practice biomimetic dentistry and I try to keep as much natural tooth as possible, so I recommended a porcelain filling, otherwise known as a porcelain onlay. You might have heard it as a partial crown. What this does is this allows us to use a very strong, healthy material like porcelain, but it allows us to be conservative and to do it in the shape of a filling. We don't have to remove a lot of circumferential tooth structure. And for all patients, but especially for my younger patients, I try as best as I can to keep as much natural tooth structure. So that's why we recommended a porcelain onlay for her. After we prepared the tooth and took the impression for the onlay, Lonnie was in a temp for a couple weeks. During this time, it allowed her tooth to heal, and then she returned back for us to place the final restoration. So we removed the temporary, we cleaned out the tooth again, we ozonated it to disinfect, and then we conservatively placed the final porcelain filling, and it just fit in like a puzzle piece, and she was done.
Hi again. You guys may have noticed that we didn't film day 3 of the procedure, and that's because day 3 was super brief and easy. It was really just going in to put the permanent onlay in place, get it filed a little bit, and checked for bite. Before we go on ahead and close out today's video though, I did want to share with you guys my review afterwards, how I felt, and my overall experience at the Center of Holistic Dentistry. After the procedure, I only had some sensitivity where the tooth was worked on for about 3 days. After that, as it was still healing, it was only sensitive if I aggravated it in any way, let's say like trying to eat on that side. So I did have to hold off doing that for a little while it was healing, and just make sure that I eat on the other side. I also did gargle warm salt water for a week after the procedure, just to kind of help the natural healing process of my gums. And fortunately, I healed extremely well. Overall, my experience at the practice was very nice. Everyone from the staff to Dr. Dalwani to the assistants were really nice and attentive. During the actual procedure, I was surprised that I had a painless experience, but Dr. Dalwani made sure to give me plenty of numbing treatment so that I didn't have to worry. I hope you found this video helpful today, and if you want to know more, please stick around for the next few minutes where Dr. Dalwani herself is going to go way more into the details of our procedure and also answer frequently asked questions. Thank you so much for watching today's video. It was a pleasure to have you here and put this together for you. If you found the video helpful, I ask if you can please give the video a thumbs up or meet me in the comments below, where I'd love to hear from you either about a story that you'd like to share in regards to a similar procedure, or if you're now considering visiting a holistic dentist instead and making the switch when and where you can. Take care, you guys, and I'll see you in the next video.
A holistic dentist takes a whole body approach when looking at the mouth. We understand that the mouth is not separate from the rest of your body. The mouth is actually the gateway to your digestive tract. We really want to focus on the materials that we use. If some materials are not healthy, how we take them out, like mercury. We focus on making sure the materials are biocompatible, they're safe, that we use preventative approach. We want to be as conservative as possible using biomimetic dentistry. We want to keep as much natural tooth structure as possible. We use different adjunct therapies such as ozone therapy, light therapy, laser therapy, homeopathics, different supplements to really boost the immunity and your oral health. Biomimetic dentistry is when we do our best to mimic the natural tooth structure, the natural shape, the natural environment of the tooth. As much as we can, we really preserve the natural tooth structure. We try to avoid more aggressive restorations like crowns. We try to do a lot of BPA-free composite restorations, porcelain fillings or onlays where we can keep the natural perimeter of the tooth. Our philosophy at the Center for Holistic Dentistry is that we believe that mercury is a toxic metal. We do not place mercury in the practice. Mercury fillings, otherwise known as amalgam fillings or sometimes known as silver fillings to really fool the public, is actually a mix of about 50 to 51% mercury along with a group of base metals. It is not a silver filling and it is not a safe filling. There are a lot healthier, better for your teeth, and actually more aesthetic restorations or fillings that we can do in the mouth. We do not place them in the practice, and we don't believe in just cutting that out and letting pieces of mercury go down your throat and swallow it, so we follow the IOAMT's safe protocol for mercury removal. First, we dress you from head to toe. Second, we use an oxygen mask over your nose so you're breathing in pure O2 and minimizing the vapors. Then we use a rubber dam, which is basically a way to isolate the tooth so none of the mercury goes down your throat or in the side of your mouth. Throughout the process, we are rinsing with ozonated water. After we clean out the mercury, we also ozonate the tooth. We have you take certain supplements such as chlorella and vitamin C to help bind the mercury and naturally excrete it. We want to make sure that we minimize the risks and the exposure both to yourself and to our team. I have a lot of patients ask me, why did you become a holistic dentist? And initially, I'm a general dentist. I graduated from UOP in San Francisco, and I practiced what everyone would consider regular general dentistry for many years. Truthfully, as my own health changed, and I realized that I didn't want to follow the traditional protocols and take medications, and I started looking for alternative ways to deal with my own health, I started realizing, what am I doing in my own practice and how can I do things differently? And then I met a few holistic dentists, and then I got involved with the IOAMT, which is basically the leading organization for holistic dentists. That really changed my life. It really changed the way I practice. It's the way I view the oral health, view the mouth, view the teeth, and view the materials that I place in my patient's mouth. Ozone is a gas. It is an O3 molecule. So think of oxygen, the air that we breathe, that's an O2 molecule, and ozone is an O3. Another way to look at it, it's basically a supercharged oxygen molecule. And we know that in order for any part of our body, any cell in our body to heal, we need oxygen. When I'm working on a tooth, when I'm dealing with a safe mercury removal, when I'm treating a cavity, we clean out the tooth with our normal instruments, and then we use ozone to naturally disinfect the tooth. Because you're providing such a supercharged oxygen, you're providing an extremely aerobic environment to the mouth. And so what happens is when we do that, we are encouraging the healthier aerobic flora to populate. Just like in your gut, when you have good bacteria and you have bad bacteria, well, there's same thing in the mouth. If we give the mouth the right environment, a lot of oxygen, supercharged oxygen such as ozone, we're providing such an aerobic environment that we are encouraging the healthier, positive aerobic bacteria to colonize first and not the unhealthy bacteria.